Yes, dear everyone, this is the day we have been waiting for. The time has come. We are lifting nearly all the COVID measures. Distance between us will no longer be needed. The meter distance will be gone, and we are removing the general advice to keep a distance. The meter has prevented us from living normal together as people, and not the least has been difficult for everyone who makes a living of us getting together, whether it's to the movies, bars, conferences, or elsewhere. Now we can see each other as before, in the nightlife, in cultural events, and other social get-togethers, and on our way to and from work, on the bus, the train, and on the ferry. And we can stop using the face masks. I won't discard it. I'll put it in my inner pocket because it's good to have it ready. No one will anymore be required to use a face mask, but we do recommend face masks for those unvaccinated and for other vulnerable groups if it's difficult to keep a distance. The same thing goes for if you have respiratory systems and visit somebody in the risk group. Then it's always wise to consider whether it might not be useful to use the face mask. And we also lift the traffic light model in the schools, and it is a great pleasure for us to say that now time has come for children to play freely in the schoolyard. But we have this traffic light model in the back if it should become necessary to use it again. We are discontinuing these measures now, and we will do this from 10 a.m. So everything that has now been said applies from now on. And we can do this for four main reasons. The Omicron virus does not give us serious illness as earlier variants of the COVID-19. And although infections rise, the share of those end up in hospital is low. And thirdly, we are well protected by vaccines. And fourthly, although sickness absence is high and we need to pay attention to it, it is largely manageable. The consequences of the measures have become no more negative than the consequences of infections, and therefore we are now removing nearly all of them. This also means that we will go far in treating COVID-19 just as any other illness. But we keep two exceptions for a transition period. Firstly, we recommend still that grown-ups with respiratory symptoms get tested. It is good to clarify whether what you have is COVID. You no longer need to get tested if you don't have any symptoms yourself. Secondly, if the test is positive, we recommend you to stay at home for 4 days and that you are free of fever for 1 day before going back to work. This is not a requirement, so here people need to think for themselves, but it's a recommendation from the authorities of national public health. And this will be assessed continuously, and we expect to change it after a few weeks. The recommendation to stay at home for 4 days does not apply to children in daycare and school. They should only stay at home for as long as they're ill, and they can go back to school or daycare once they have had no fever for 24 hours. They don't need to get tested, and I think that many children, that is my experience, will be very happy to learn about this, that their parents won't be coming running, forcing a stick up their nose anymore. So, dear everyone, today we have the 12th of February, 2022. And the 12th of March 2020 now appears as quite a surreal day when Norway was locked down. And I think nobody then could imagine that many of these measures would last for nearly 2 years, that there would be rules for how many people you could have visit you at home, and that a government could close down schools, and that you couldn't go have a beer out with your friends, go to a football match, do sports, and live the ordinary life. Luckily, we didn't know then how long this would last. Now everyday life will turn more normal again with its normal ups and downs. But I will emphasize that this does not mean that we who are here now can declare the pandemic as ended. We are right in the middle of an infection wave, and there's high infection levels in society, and it can still increase. And therefore, infections will still mark our society for yet a while. Sickness absence is manageable at large, but it can become critical in certain places. And because of that, it's a very important message for each employer, each employee to pay attention to this, depending on the situation at their place of work. As many as 3 to 4 million people can get infected in the course of this winter wave, and that can harm the health services, the nursing homes, schools, daycare centers, and other important functions in society. But the review that the government had earlier this week of the critical functions in society indicate that they are functioning and can function in the normal manner. So still, it is justifiable to ease up. The virus no longer constitutes a great health threat to most of us, and more than 2.7 million people have had their third dose vaccine, and that's excellent. We are well protected, and we're not served with prolonging the pandemic. Then there's also something that I would like to emphasize today. Although it is justifiable to discontinue measures, I know that some people, quite a lot of you in fact, are worried that we're letting up too much and too soon. I do understand that, and I do respect that, considering what we've all been through. Some people will still need to keep a distance, and therefore we also make separate recommendations for those who have an increased risk of serious illness and those who live close to these people. The rest of us who cannot need any restrictions in our lives anymore, we need to be considerate. And the most important resource we have then is solidarity with others and common sense. It is far harder to live a limited life when you have to do it alone and everyone else go back to the normal, and maybe you are in a small minority. And then it's also important for me to emphasize this. Although the pandemic transitions into a new phase, it has had a great impact to many people, which is not over just because we return to more normal everyday life. Some have lost their dear ones, and we will keep them in mind. Others have lost their job or their life work. And many children and young people have lost valuable learning in school or in their studies, and they have lost valuable spare time. The pandemic has made many people ill with COVID-19, and many are still struggling with repercussions of the illness. And it has given us other national public health challenges that have not had as much attention, but that have the attention of us in the government, because national public health is the foundation of all other health in society. Several people have been struggling with their mental health, and many have lost important attachment to volunteer activities and sports. And here, adolescent dropout rates worry us. And we know that many people are struggling with the repercussions of COVID in the long run. And we can see this more clearly now when most people are leading normal lives. I would really like to see us all face this challenge too, of the impacts of the pandemic equally seriously. We have been united through the pandemic and will also emerge united from it. We have jointly been there for those who have been struck, and we will still be there for each other. The pandemic has impacted us in different ways, and many people who were already in a difficult place have had an even harder time, and it's an important appeal to see them and be there for them. And at the same time, as a community, we need to be prepared that there may be new downfalls. And because of that, our society needs to have preparedness at hospitals, in municipalities, in places of work, in schools, and in families. We may see new waves of infection, and there may come new variants. The virus can surprise us and mutate again. The pandemic is unpredictable, as we've seen before. Because of that, we have now designed a preparedness plan with various levels, and the health minister will tell you more about it. But today, we can go out and spend time together without being afraid of getting in contact with each other. And that is a good feeling and a good start of this weekend. And with that, I will give the word to the Minister of Health and Care.
Thank you. And good morning, everyone. I believe that I'm not the only one who's gotten used to keeping others at an arm's length distance. In the beginning, it was because we were afraid to be infected and to infect others. And then it became a habit. Now we get startled, perhaps sometimes if people move too close. Some of us might even have frowned at people who get too close. So I'm glad that this is the end of the 1 meter rule and that we are now trying to get back to normal. At the last press conference, I said that we will now reclaim our daily lives. Now we can do what we want without thinking about the 1 meter rule, both in our daily lives but also during the weekend. Now that we are leaving the 1 meter rule and the face covering, we are left with common sense and consideration for others. For a long time, we've been used to the state telling us that what we have to do and what we should do. Now we will only receive advice and recommendations. This means that the state will no longer tell us what to do, but it will still give us some advice. And you will find these on helsenorge.no and on the National Institute of Public Health's websites. In addition to the advice, we have a general recommendation to think for yourself and use common sense. When we say that you should stay at home for 4 days when infected, this is not an obstacle to finding good alternative solutions at the workplace, if this is important and decisive to keep things going. Even if the 1 meter and face covering requirement will disappear for most of us, you should also be considerate if you meet someone who's still using face covering. As the Prime Minister said, we are giving special recommendations for those with an increased risk for serious illness, and we must remember that some people are now more alone, with a continued need for infection control measures. The virus is continuously evolving. There is still a lot of infection around us and a high sick leave rate many places. This leads manning challenges, amongst others, in hospitals, municipalities, kindergartens and schools. This is why we still need to stay in control, so that sick leave in society doesn't become too high, to protect those of you who belong to the risk groups and ensure that everyone gets the health services they are entitled to. And this is manageable even if we open up and remove measures. The most important things for everyone now is: get the vaccines, which you are recommended to take. Get tested if you're an adult with symptoms. Stay at home for 4 days if you're an adult with a positive test. Stay at home if you're ill. And remember that there still are other diseases than corona. Children in kindergarten and pupils do not need to get tested and stay at home if they're not ill. We've become very competent at many things throughout this pandemic, and we need to bring this with us forward. We know how to protect ourselves against infection. We've acquired good hand hygiene habits. We've stayed at home when we have symptoms of cold, and when we're ill, we will continue doing this. But like the days outside of this room, life will also become brighter and easier as we move forward. I would encourage you to visit bars and nightclubs, restaurants, theaters, concert arenas, dancing floors. There you will meet people who have been waiting for you. We will reclaim our lives, live more normally, fill up the happy memory bank with references to good experiences. And that is also important for our mental health. I would encourage you to be active every day. Do something with others every day, and do something which gives meaning and joy. What will happen now? We're not completely letting go. We have to follow the development going forward, both regarding capacity in the health sector and the infection rate. The municipalities also need to have plans that take into account how to handle local outbreaks. And even if we are now removing requirements and regulations, the pandemic is not, as the Prime Minister said, over. The government pays a lot of attention to emergency preparedness and is in the process of strengthening this. We're working on a new long-term strategy and emergency preparedness plan to cope with COVID-19, which is a live-with strategy. This virus will be around for a long time. The hospitals must have plans and be ready for a more flexible, intensive care capacity and be able to rapidly increase the number of beds. Vaccination will still be important, and we've already ordered a high number of vaccines, both from Moderna and Pfizer-BioNTech, who will be able to deliver vaccines adapted to the new virus variants if necessary. We have the possibility to reintroduce the COVID-19 certificate, entry registration and control centers for arriving travelers if need be. All these are tools in our toolbox if we see the emergence of new virus variants or winter waves. We're also in the process of establishing packages of infection control measures adapted to different situations and levels of measures, We will listen to all sectors and make sure that the measure packages are well known and ensure predictability if we have to reintroduce measures. Some things we would, of course, rather not do. We are now removing all entry measures, both entry registration and testing prior to arrival in Norway. A number of other countries still have both entry measures and national measures in place. It is therefore important that those who travel acquaint themselves well with the requirements in other countries. Many countries require a valid COVID-19 certificate for entry and for attending, for example, concerts, exhibitions, and restaurants. The Ministry of Foreign Affairs have adapted websites that might be useful to visit if you have travel plans. I would also take this opportunity to thank all of you who have been working hard throughout this pandemic. And even if the pandemic is not over, we are now moving towards brighter days, not only because the spring is in the air and the days are longer. I hope that all of you who have given so much throughout this pandemic know and feel that precisely your effort has been decisive during these last 2 years. This is a happy day. It's time to fill up the memory bank with other experiences, less anxiety, use common sense, hug a friend. That's what I will do. And if there is no camera around, I will perhaps even do a little dancing. I now give the floor to the National Institute of Public Health and Camilla Stoltenberg. We'll start with Bjørn Gullvåg.
Thank you, Minister. Starting today, testing recommendations will be simplified. We no longer distinguish between whether you're a close contact, member of the household or not. These are concepts that the Norwegian population have become familiar with through the pandemic. What now applies for all adults is if you have recent respiratory symptoms, take a self-test. Testing household members and equivalently close people with no symptoms is discontinued. Although we are now removing both the meter and the face mask in most situations, we still wish to avoid very high sickness absences, creating problems for the health services or other critical societal functions. I would like to remind you that Omicron for some people can still give serious illness. Therefore, we still remind you of the importance of vaccination to protect yourself and others against serious illness. High vaccine coverage also helps to reduce transmission and sickness absence. Starting today, the rule will be to stay at home for 4 days since the time you have a positive test or from the time you experience symptoms and until you have had 24 hours without a fever. The recommendation to stay at home for 4 days, as we already have heard, does not apply to children in daycare and school. That is, those in secondary school and younger, but they're still recommended to stay at home the days when they are ill. Still, there are groups in society which are additionally exposed to being infected. And both the Prime Minister and the Health and Care Minister have mentioned this, but it's a very important topic now. Naturally, I have in mind those who, due to illness or medication, have a reduced immune defense. This applies to many patient groups and health services on immunosuppressive drugs, among other those with an organ transplant, many with cancer or illness such as rheumatism and a number of other autoimmune illnesses. Several of these have had limited effect of the vaccine due to the treatment that they are receiving and have a greater risk of serious illness if infected by COVID-19. This can apply for up to 200,000 people in Norway, both adults and children. If you encounter people wearing face masks in the stores, you would be considerate to keep an additional distance to these unless otherwise informed. I will also encourage schools and employers to be especially to facilitate so that people with a higher risk are well taken care of in the next few weeks. We are now in a phase of the pandemic where many people are getting infected but few turn seriously ill. Still, there has been a considerable increase in infections in municipal institutions and nursing homes in the past few weeks, and operations can be challenged if many employees get ill at the same time. The population needs to be prepared, for in the next weeks it may be difficult to maintain the services offered in the municipalities at the level that we are used to. We have designed a guide for how health and care services in the municipalities should prioritize if capacity is insufficient. In hospitals, we now see diminishing pressure on the intensive care units, but there is a somewhat increase of admitted people with COVID-19, in other words, and now people are being hospitalized both for and with Omicron. If you have symptoms of COVID-19, we recommend you to get tested, and it's possible to get self-tests in the municipality where you live. We have a good supply of self-tests for those who need it. Municipalities have reported that now in total they have about 9 million tests in municipal stock. And this week we are also shipping out 8.2 million tests more to the municipalities. Still, some municipalities may see that they have a shortage of tests. And with that, I will give the floor to Director Camilla Stoltenberg of the National Public Health Institute.
Thank you, and good morning. This week, we have more new patients admitted in hospital than last week. The increase is around 40% compared to the same time last week. We believe we will see such an increase in the weeks to come as well. For how long, we're not sure. There is still a significant spread of the virus, and many are asking where we stand in the Omicron winter wave right now. How close are we to the top? The answer is that we don't know exactly, but we believe that we're close to the peak of the infection. It might be behind us at some places in the country, but before us in other places. At the national level, we don't think we've reached it quite yet. The impact of the spread of the virus will peak after the infection rate starts to go down. That goes for the sick leave rate, hospital admissions, number of patients on ventilator, and deaths. The hospitals and the municipalities are prepared and believe that they will cope. And for a well-vaccinated population, Omicron is less dangerous for each inhabitant than Delta and other variants we've experienced. We therefore think there are no clear advantages in prolonging the epidemic, but we will have to go through it. But will the pandemic be over after the winter wave? No, the pandemic is still ongoing in the world and many are not yet vaccinated nor infected. Is this the end of the pandemic in Norway? We don't know the answer to that question. First, we have to handle the challenges which will follow the winter wave, and many are still in a demanding situation when it comes to this handling. It might be possible that the epidemic is over in Norway, at least for now. But the coronavirus can come back in new waves with known and new variants. This is why society as a whole, and especially those of us who are responsible for emergency preparedness, must be prepared for other options, other scenarios all the time. And we have to learn from the 2 previous years so that we can do better if and when there are new waves or new variants. This is also urgent. Today, we're happy to be free from measures, but we will not have any free time. Thank you.